Today, we are honored to welcome Daniel Fontaine to our podcast. Daniel is the newly elected interim mayor of New Westminster, but his journey here is nothing short of inspiring. Before stepping into municipal leadership, he served as the CEO of the BC Care Providers Association, where he championed the needs of seniors and care providers across the province.
A large part of the work that I was doing for pretty much all the organizations that you listed was advocacy.
His leadership path also includes serving as Deputy Minister and CEO of the Métis Nation BC, and he currently brings his governance expertise to the national stage as a member of the Board of Directors at Hockey Canada.
It's so critical that as a leader, a senior leader, you're able to kind of look at that 30 to 40,000 foot level and to be able to give them hope.
Daniel's career has spanned politics, healthcare, and community building. And today we'll dive into the experiences that have shaped his vision for leadership and the future of our communities. I'm Heather Maxwell, and I would love for you to join A Minute with Maxwell, Mission in Motion. Welcome, Daniel, to our podcast.
Thanks so much for having me.
So, Daniel, you have had a career, as I just mentioned, that spans healthcare, Indigenous leadership, municipal governance, and even national sports. Was there a common thread or value that guided you through these transitions?
Well, first of all, Heather, thank you very much for inviting me on the podcast. This is amazing to be invited. I do appreciate it. And I also want to just clear up for the record that I actually worked in the beer industry too. So,
I forgot. I'm so sorry.
That's okay. I worked there for like a few years. So it was like, I was trying to think, did I work in another industry outside of healthcare and public service and government?
Wow.
And I worked for a little while with the Western Brewers Association. So your question pertains to kind of a common thread. And for me, I think that when I think back at my career, there's really two things that kind of tie everything together. One is that a large part of the work that I was doing for pretty much all the organizations that you listed was advocacy. So I was working with either the nonprofit or with, for example, the care providers or Canadian Association for Long-Term Care, often advocating for government changes, for perhaps additional funding for things like when I worked at MyTax, which was a national or a nonprofit that did internships at the universities, we were advocating for more funding for that. So advocacy is one of the common threads that goes throughout my entire my entire career. The other piece would be, I would say, public service is so much of what I've done, even at Hockey Canada, for example, over the last year. Really, it's public service, and I've volunteered on a lot of boards. I've like I did do with Hockey Canada. And then when I look at all my stint with the federal government, my time working at the mayor's office in Vancouver, a lot of it was public service. So you combine that advocacy and that public service, and that pretty much captures a big chunk of my career over the past 25 to 30 years.
Wow, that is quite the career path, Daniel. And so you have also, speaking about public service, you have also recently stepped into the role of interim mayor of New Westminster, BC. What inspired you to run for this position, and how have your past leadership roles from, as you mentioned, being the CEO of the BC Care Providers Association to Deputy Minister and CEO of the Métis Nation BC shaped the way that you approach governance, culture, community, and the challenges of municipal leadership?
Well, just to clarify, so I was elected as a city councillor in 2022, the first time that I was elected, and I serve as acting mayor every year in the months of September and October. So it gives me great pleasure to, when the mayor is unable to attend events or if he's unable to chair meetings, I step in as the acting mayor. So I take that role quite seriously.
Yes.
So you've got me at a time. You've interviewed me when I am, in fact, the acting mayor of New Westminster. In terms of looking back on my career and all the things I've done and how it's kind of helped shape my perspective at City Council. What I love about when I look back at my career, whether I worked in the federal government with when I was working with unemployment insurance or the immigration program, whether I worked in the private sector, like I said, in the beer industry, I've worked in academia with my tax and helped students to get internships, worked in healthcare for nearly a decade in the long-term care sector as the CEO for BC Care Providers. It has really all helped to shape me. I mean, I look back at the last 3 years on council, and there's been so many reports and so many debates and so many discussions that because of my lived experience and my past career, I've been able to bring those to the table.
The one thing that I know about working with you, Daniel, is that you have this amazing ability to just make every person that you speak to feel heard and feel special. You are very in tune with what's going on in your community and really across BC and Canada. But you just have a great ability to listen to people and to understand, and maybe not always agree, but understand what their concerns are, and just to make people feel heard and again, part of the community. So I know that about you because you are a great listener, and like I said, have this great ability to make everyone feel important and heard. And so, can you tell us? I always like to ask this question: where did you start your career? What was your first job?
Well, technically, my first job, I was born in southern Manitoba. I was born in a Métis family in southern Manitoba, a very small town. And my great uncle owned a vegetable farm. And
Oh,
he had a tract of land along the Red River. And he had this farm that produced peas and beans and lots of other vegetables. And my grandfather, who really instilled a lot of really good work ethic in me when I was very young, I think I must have been like maybe 12 or 13 years old.
yeah,
He said, "Why don't you come to the farm with me and let's pick some beans and some peas and you can make a little bit of money." And
yeah,
Heather, I was paid 19 cents a pound, just to give you some perspective of how long ago this
yes,
was.
yes,
I just
yes,
bought a pack. I just bought a pack of peas yesterday at Walmart. It was like $11 for just a pack of peas.
yes,
So it was 19
yes.
cents a pound. And so I
Oh,
worked a number of summers. That was my first official job where I
wow.
would go out in the morning. It would be very hot in the summertime and put my cap on. And I just, worked all day and I picked into fields and did that for, I believe, at least almost 2 to 3 summers where it gave me some extra cash to buy a bike or
Wow.
things that I needed. So that was really my first job.
That's amazing. And I didn't know that about you, Daniel. And we have that in common because my parents had a farm. And at 10 years old, I started out picking rows of potatoes for my dad, and he would give me 25 cents a row. So very similar. And so, Daniel, as the former CEO of the BC Care Providers Association, you have been a strong voice in seniors' care. And what do you see as the biggest challenges and opportunities in long term care today? And what do you wish the wider public truly understood about continuing care? And now that for the first time in history, we have more seniors than children in our demographic.
Well, that's a three-part question, so I'm going to try to answer it. So if I forget a
Sorry.
part of the question, just remind me. But I'll start
Yes.
kind of with the front end, which was the challenges and opportunities for the sector. I think, Heather, I've been out of the sector now for a few years because I haven't been the CEO for the BC Care Providers for a number of years. But I will say that sadly, we're sitting here in the fall of 2025, and I can report that many of the challenges that the sector faces today are absolutely identical to what
Yeah.
they were 5 to 10 years ago. The
Yeah.
only problem is they're becoming more acute.
Yeah.
And as the population ages and that demographic bubble kind of makes its way up to the top, the issues that we talked about and theorized and I lectured about at various places around the country when I spoke, they're now coming home to roost. And my spouse had a health scare over the last year, and I had to spend, unfortunately, too much time in emergencies, in emergency hospital. And I was shocked, and in many ways not shocked, to see
Yeah.
so many elderly people in the acute care system. So that's a huge challenge, just around
Yeah.
getting enough people to work in the system, like the human resource, they call it HHR. The
Yeah.
HHR issues were front and center for me when I was the CEO a number of years ago, and they're still front and center, just around getting enough bodies, qualified bodies, to work in the jobs. So
Yeah.
that's the challenges. I think from an opportunity side for the sector, I'm somewhat inspired, although I'm still a bit suspect, but I'm somewhat inspired around technology and AI and what it might be able to do to help in keeping seniors less lonely and being able
Yeah.
to use AI and technology for interactions within a care setting and to be able to assist and to kind of perhaps even fill the gaps in some respects where there isn't the health human resources there on
Yeah.
site. So I'm curious, and I think it's an opportunity if it's used properly and if it's used correctly within a care
Yeah.
setting. There's maybe an opportunity for us to rethink the way that we deliver long-term care, certain aspects of it, anyways, within the system. And then lastly, the third part of your question, I think, pertained to, just remind me now because it was a three-part question.
Yes. What do you wish the wider public truly understood about continuing care, Daniel?
Yeah, I think that for me, the misconception I think around continuing care is that that it's a cost, like
Yeah.
it's a line item and expense to, and yes, for sure, there is an expense, but very few people understand that when you invest in things like continuing care, you're actually saving money because you're
Yes.
reducing the need to invest in places like acute care hospitals. And if you
Yes.
look at the cost per bed per day for an acute care hospital versus, for example, in a senior's care or a long term care home, it's not even comparable. And yet,
No.
Heather, when I was in those hospitals, I can't tell you how many people I saw in the beds. I spoke to the nursing staff who
Yeah.
said, Mr. Smith, he should be at a long term care home, but he's here at a
Yeah.
$3,000 to $4,000 a day bed, in acute
Yeah.
care, and we have no place for him because the government hasn't built enough care homes to put these people in, and we don't have enough home care, and nor
Mhm.
is it appropriate for someone in his condition to be at home with home care. So
Yeah.
that's the part I think, Heather, I wish the public understood, and I wish they
Yeah.
would advocate more, and I wish they would call their member of parliament and their MLAs and their MPPs, and
Yes.
that they would encourage them to make those investments in with the full
Yes.
understanding that government is broke. I mean, it literally is
Yeah.
broke. There's massive
Yes.
deficits.
Yes.
And the time to have done this, Heather, is better than most, should have been 10 to 20 years ago, but
Yes.
we have to get moving.
Yes, it's so true, Daniel. And I'm so sorry to hear about what happened with your spouse. That is so sad when it hits us personally. Then it really hits home, right?
Yeah.
And, you're absolutely right. The cost of the acute care beds is just astronomical, as we know. And we know that in BC alone, there are thousands, I think it's over 7,000 people, if I'm not mistaken, waiting on a long term care list to get into long term care, right? And
Yes.
it takes a year to even get a potential placement in long term care.
Yeah, and kudos to you, by the way, for the great op-ed that you had in the Vancouver Sun, which highlighted some of those points in terms of the
Yes.
total number of people waiting and the fact that we
Yeah.
got to get going on these
Yes.
investments. And Heather, I think in your op-ed you pointed out that for some government-owned and operated long-term care homes, I think it's close to $1.8 million now per bed to construct them.
Yes.
So
Yes.
government needs to, going back to our previous discussion around nonprofits and working with
Yeah.
nonprofits and the private sector, why government is investing $1.8 million a bed when it can be done for so much less expensive in the private and nonprofit sector is beyond me. But
Yes.
that's where government's going.
Yes, I know. And to your point too, Daniel, like I appreciate that you have said it takes a village, right? We all need to work together. This is not about, oh, acute care needs so much money, long-term care needs so much money, home health care needs so much money. We all have to look at how are we working together, right? To support the seniors at the end of the day in our communities, right? So that they don't have a crisis and have to be rushed to the hospital and just stay in the hospital and not be able to access long-term care. I mean, it's so critical that we're all working together to find solutions, right?
Oh, 100%.
And what bothers me, being in people and culture, Daniel, is the fact that there are solutions that we are not utilizing right now. So, for example, we know that there are approximately 12,000 internationally educated nurses in British Columbia right now that are not registered to practice nursing in British Columbia. And there seems to be a lot of unfortunately, red tape and bureaucracy, and these internationally educated nurses that are already in the province, living in the province, that could be contributing to our healthcare system. It is just not being made easy for them to gain their licensing and get working as a registered nurse in the province of BC. Some of the other provinces across the country we know have streamlined that process, which is amazing. So we
Mhm.
can get these internationally educated nurses working and contributing to our, system, which we desperately need. And so, what are your thoughts on that, Daniel?
Well, you've hit the nail on the head, and I know I might sound a bit trite, but I'll tell you a joke that kind of captures this, which somebody told me not long ago, and they said if you want a doctor in British Columbia, all you have to do is phone Uber,
Yeah,
because they're driving the car, right?
I know.
And
Which is sad. Which is
which is
sad, but
sad.
true.
And that's
Yes.
the same with nurses. We have 12,000 is what you quoted there.
Yes.
12,000 trained nurses who could be
Yep.
working at Tim Hortons or working in the service sector or who knows,
Yep.
working in a bar. And they
Yep.
should, like, it's just, to me, it's mind boggling that we
Yep.
have all this trained talent within the
Yes.
province of British Columbia. We don't have to recruit them. We don't have to bring them in. They're actually already here.
Already here. Yes.
Yeah, and
Yes.
that we're not finding a almost like a military style operation of like get these people to work, like get them
Yep.
the certification and stuff. And
Yes.
I don't know, Heather. I don't know why government hasn't fast tracked that, or why they don't see that as an urgent need to get those folks working. And it's
Yep.
not nurses; it's docs and other
Yes.
specialists who are
Yes.
in the, remember that health ecosystem we talked about. There are
Absolutely.
lots of specialists who are trained. And here's the ironic thing about it, Heather, is you could be Canadian, go abroad, get trained as a specialist in one of the top universities, come back,
Yep.
and you can't work because you're not
Yeah.
your training isn't properly recognized and easily
Yep.
recognized, and you have to go through a whole bunch of red tape and hoops to be able to
Yep.
work. We have to
Yep.
change that. We have to change
Yeah.
that. And but people have been saying this now for 20, 30 years. We have to
Yes.
change it. And I'm not
Yes.
sure why government's not acting.
Yes, the credentialing process needs to be streamlined. I know Alberta has done a good job of identifying with nurses in specific. I believe it's either 7 or 9 countries that
Yeah.
are on par with Canada and have the same Bachelor of Science in Nursing. Like it's on par with ours. We know this,
Yeah.
and so they have streamlined and almost given those nurses like a Nexus pass sort of thing to get credentialed in Alberta and get working. So kudos to Alberta because they've done a good job with that. And BC, I feel, needs to follow suit in doing that, number one. And number two, there are things, Daniel, like dual credit programs out of high school that I feel, we should be looking at as well to get perhaps more healthcare aides
Yeah.
working in this sector, right? Having that dual credit program at the high school level and getting people in the system that would like to, pursue that as a career, the healthcare aid as a career.
Two great suggestions. The first one, by the way, doesn't cost the government any money. It's
Right.
like it's almost like a no-brainer. Like these people are already trained. They've been trained by other universities outside the country that was paid for by other taxpayers. Like why you wouldn't tap into it, number one, is incredible.
Yeah.
And secondly, on the
Yeah.
dual credit program, for your listeners who maybe don't know about it, basically that program is you go to high school and you identify that you want to be a healthcare aide. That's an area career you might want to go into. By the
Yeah.
time you graduate from high school, Heather, you are able to walk across the street if there's a care home and you can start work the next day. So you don't
Yes.
have,
Yeah.
you're certified, your high school certifies you as a proper HCA trained. You leave
Yeah.
that school, you have no student debt, you're contributing to the GDP, you're supporting a family, you're getting good wages right off the top.
Yeah.
Why wouldn't we be doing more of that? Um,
Yes.
Unfortunately, Heather, far too often the dual credit program typically gets put into trades and not into
Yes.
healthcare. So you'll see a lot
Right.
of primarily young men who
Yeah.
are coming out of high school with that certification when they come out of high school, but a lot of young women who may or may not want to go into healthcare, they're not able to have that access. So there's an
Yeah.
equity issue there too, I think, that needs to
Yes.
be addressed. But
Yes.
again, I'll point out to government that investing in dual credit is way less expensive and way more effective for the economy and contributing to the
Yeah.
economy than having somebody get their training post, have to pay out of their pocket, have student debt, et cetera, et cetera. It just makes no sense.
So, Daniel, we are in a bit of a crisis in healthcare. We know this. And you've been in, as we just discussed, in leadership roles during some of the toughest times, whether in healthcare or governance. So, what do you feel it takes to lead teams through crisis?
Well, I did not want to be leading through a crisis, but we all
Yeah.
had to go through the COVID pandemic.
Yes.
And I tell you, I think if I look back on kind of the time that I was there at the BC Care Providers when we were really in the heat of it all, when the COVID pandemic just started, I
Yeah.
think the qualities that you need in a strong leader are a steady hand.
Yeah.
You talked about listening skills, and I think that often in a crisis, people forget that there's two parts to
Yes.
communicating. One is talking, the other one is listening.
Yeah.
And far too often, people are just talking and talking to you and telling you what to do, where to go, how to do this. So I think that having a steady hand, calm hand, having ability to listen, and be able to look at the big picture and to be able to pull up and know that your staff are at maybe the mid-level or frontline operation, and they really can be just so focused on that. It's so critical that as a leader, a senior leader, you're able to kind of look at that 30 to 40,000 foot level and to
Yeah.
be able to look at the big picture and to bring people out to the other side so they can see themselves having survived the pandemic, having, come out the other side,
Yes.
to give them hope that
Yes.
sure, things are dark. I remember when we closed our office at the BC Care Providers the final day. I brought all the staff in, and Safe Care BC staff. We were co-located in a physical office in Burnaby. And the last time I ever saw all these people together, we were all in one room. And I said to them at the end, I said, we may not ever see each other again. We may not come back here right away, and things will happen during our lives. But I said, we're closing the office, indefinitely.
Yeah.
And I said, but just know this, like, we'll make it through. Like, we will get on
Yeah.
the other side and we'll hunker down and we'll do everything we can to help those seniors who are way more vulnerable than we are. And
Yeah.
everybody go home, turn on your Zoom, turn on your laptops, and away we go. And yeah, it takes that, I think, that kind of leadership and that steady hand to get you over a crisis like that.
That is so true. And you mentioned the word hope. And I think that that is key. You have to give people hope, and
Mhm.
people, want to be part of something meaningful at the end of the day, right? So that those are all, I mean, that's key, Daniel, what you just said. I think that's really, really key when you're leading, especially in times of crisis. So you've been through SARS and COVID, actually. And so, do you foresee future pandemics? And if so, how do you feel that we should prepare, or leaders should prepare their organizations for, something else like this?
Well, first of all, if you're under the illusion that we will never have a pandemic again, you're already behind the eight ball. So
Yeah.
we will have another pandemic. But I think Um, Heather, the part that I think would tie into the pandemic, perhaps, and maybe is a bit more come to home for people, is that we're living in a world now where you can wake up and have a massive forest fire just a few kilometers
Yeah.
from your community, and you could be evacuated. We live in a world where we have raging
Yeah.
storms that are clocking in 100 kilometers more wind hour per hour than they were before. I mean, I can go on and on with the various kind of weather related crises that have maybe perhaps not as long an impact as COVID, but can have a disruptive an impact on, for example, long-term care, where you might have to evacuate, decant people from one care home to another, etc. So my advice to everyone
Yeah.
is, be prepared for what you don't know will happen and have that plan ready. But don't just have the plan, because remember, the BC government had a pandemic plan. Like, we had a plan on paper,
Yeah.
but the way I
Yeah.
describe that plan is it hadn't been tested really. It was sitting on a shelf.
Yeah.
It had gathered lots
Yeah.
of dust.
It's so true. And that is why every long-term care site has to have an emergency plan as well, right? And it's so important, like just like we test our fire alarms
Yes,
regularly, right? And we have the sprinkler systems. Like it's
yep.
just so important to keep up with that, right? Even though sometimes it's easy to go, we've got it, it's there. But really, you're right. It is really important to test it quite frequently to make sure it is operational, correct?
Have a plan, and when you have a plan, make sure you test it. Having a plan is half the
Yes,
plan.
half
Like
the plan, yeah.
like
Yep.
testing it is really the important piece, making sure it's actually going to work when you need to have the plan operational. And that to me is
Yeah.
a valuable lesson from the COVID pandemic that we could all learn and apply to other emergencies and other crises that might happen to our organization.
Yes, that is so true. And so in your current role, in the interim role as mayor, Daniel, what are the top priorities you want to address for the people of New Westminster in your during your time?
Mhm. Well, Heather, I'm not sure if you're aware, but I just declared that I'm going to be running for mayor in the upcoming election in a year from now.
Yes.
So, yeah, the election is in,
Congratulations. That's so exciting.
thank
So
you. Yeah,
exciting.
October 2026. I'll be having my name on the ballot,
Amazing.
hopefully
Amazing.
go from councillor to mayor. And so we have a number of issues within the community. We're the oldest city, incorporated city west of Winnipeg.
Oh,
And very
wow.
few people know that, we were the first capital of British Columbia. New Westminster is a very
Oh,
old city, and
wow.
it has a lot of history. And as a result, there's some really great things that come with being an old city, and that includes the heritage homes, the old heritage
Yeah.
buildings, the beautiful design and architecture. But the other side of it is you have old pipes and you
Yeah.
have old sewers and stuff that need to be replaced, and
Yeah.
there's a cost associated with that. And so we are, as an older city like the city of Vancouver and New West are two of the oldest cities in the province. We have unique challenges around infrastructure, and so there's that. Secondly, we are the second most dense city in all of Canada,
Oh, wow.
only after Vancouver. So New Westminster has
Mm,
the highest density of any city in all of Canada, right after Vancouver. And
wow.
that brings with it some real good opportunities for us because it increases
Mhm.
our tax base. We lower our carbon footprint by, not urban sprawl. But our city is facing some significant challenges around what I refer to as the infrastructure deficit. All that growth over the past couple decades has not been attached with new pools, new
Yeah.
parks, new playgrounds. So there's way more people on a very small footprint of land that don't have access to, for example, green space or parks and
Mm.
playgrounds. So those are a couple of the key issues that we're
Yeah.
facing. And I have a feeling, Heather, will be coming up on the campaign trail over the next 12 months as we head to the election.
Ah, that's so interesting, Daniel. Well, I wish you all the best in your run. That is for sure. So over the course of your career, Daniel, which setback taught you more than any success ever could? We usually learn from our challenges and our setbacks, right?
Yeah, I think I'm going to go back probably to the pandemic for me, because I
Yeah.
think that was, going back to the early 2020 when the pandemic kind of really hit. we were flying high at the BC Care Providers. I mean, we couldn't, just felt like we couldn't do anything wrong. We were just like knocking it all out of the park. And we were
Yeah.
just so successful on so many different fronts. And we literally got knocked to our knees. I mean,
Yeah. Yeah.
we were successful at running events. We had a successful conference. We were planning a seniors expo at the Trade and Convention Center, and a kind of a whole expansion into more kind of retail, kind of public side of all of this. And
Yeah.
everything came to a halt. And it was
Mm.
such, for me, for someone who has gone through his entire life saying, I can do this. Like,
Yeah.
if I just set my mind to it, I can do this. This was the
Yes.
first time in my career where I couldn't do it. Like,
Yeah.
I literally, I couldn't do it. We
Yeah.
couldn't put on a conference. We couldn't bring people
Yeah.
together. We couldn't do the things that we did that made us so successful as an organization.
Yes.
And if I look back on my career, that was probably the largest kind of setback or kind of
Yeah.
period in my life. But I've learned from it. I
Yeah.
mean, I become a stronger person. I become a stronger
Yes.
leader as a result of it. And I also taught me to learn how to better weave and move and bob and kind of like a pivot
Yeah.
when things are put in front of you, like when you can't solve a solution with a set of tools that you've had for forever.
Yeah.
How do you find new tools and how do
Yeah.
you implement those tools? And it taught me, yeah. So coming out of it, although it was a setback, I feel like I came out of it a stronger person and a stronger leader as a result.
Yes, that is so true. And so you currently sit on the board of directors at Hockey Canada, which is so exciting. I love that. So, how has your involvement in national sport governance shaped your perspective as well as a community leader?
Good question. I think I'd reverse it, Heather, if you'll permit me. I actually feel like it's the other way around. That my own personal and local experience is actually impacting Hockey Canada. And when I
Mhm.
asked, there's only 9 people in the country who are appointed to the Hockey Canada board. So it's
Wow.
an incredible honor to be
Yes.
sitting on the board of Hockey Canada with some incredible people who love
Yes.
hockey and who are passionate about making reforms in hockey and advancing the sport for women, girls, and for the entire country. And when I asked, like, why me? Like, how did I get chosen out of so many people? I'm certain had put their names for it. And
Yes.
I thought it was interesting. They said, when we looked at your resume and who you were, you had such a real connection to the community, to hockey. Like, you sat on
Mm.
the New West Minor Hockey Board, you
Yeah.
were the tournament director, you work at ringside every tournament, and you're doing the announcing in the arena, and you're still volunteering. Like, you're very connected with the community of hockey locally, and that perspective,
Yeah.
they felt, would bring an extra set of values to the board table, which they
Mhm.
thought was much needed. So, yeah, in many respects, the stuff that I learned, the kind of on the ground, the being here on the front line of hockey, so to speak, in the community, I think has helped. I've only been on the board for a year, but I'm hoping that my contributions in that year, based on my local community experience, have helped to strengthen the board, and it helped to make hockey an even better sport in the country.
Oh, that's amazing. And what incredible people to be hanging out with, Daniel. I must say, that's amazing. So, when you think about your legacy, Daniel, whether in healthcare, sport, or municipal leadership, what do you hope that people will say about the impact that you've made?
Yeah, I hope that, when people look back, when I'm sitting there, perhaps as I'm heading off to my care home at some point, maybe into the future, I hope people look back and say that, he taught me to ask tough questions.
Yeah.
He encouraged me to challenge the status quo. He gave me the encouragement to say, that's not good enough. Like, let's try
Yeah.
something different. I
Yeah.
want to leave kind of my years of public life and community activity with people feeling more emboldened and feeling like we've strengthened our democracy, that people feel encouraged to challenge my perspectives on things. And it doesn't mean, like you said earlier, I may not agree with everybody,
Yeah.
but I will fight to the end to make sure that they have the right to speak their mind and that they have
Yeah.
the right to say what they want to say, as long as they're respecting my right to say what I have to say in my
Yes.
position. It makes
Mhm.
for a much better country, a much better
Yeah.
province, city. And I have almost my entire life fought for that, for the right for the underdog. And I've kind of typically been
Yeah.
working with the underdog and making sure that
Yeah.
they get that chance to have their voice heard. And
Yes.
lastly, I'm hoping that, and I mentioned it earlier, that if I can leave one thing with people to understand is that, as I said, conversations have two parts to them,
Yes.
listening and speaking. And far too many people only see the speaking part of it as a part of a
Yes.
conversation. And if we can get more Canadians doing both listening and communicating and speaking, and that will truly make for meaningful conversations, in my opinion.
Oh, so true, Daniel. So true. I love how you ended that. And in fact, isn't that called democracy?
It is. Unfortunately, we've strayed from many of those values, and I think
No,
we've
it's
lost
true.
our way in many ways. Like we tell people they can't speak. We tell people that they're not entitled to have certain thoughts in universities,
Yeah.
etc. And I
Yeah.
think we need to encourage people to have. There's a lot of things that you and I probably don't agree with a lot of people,
Yeah.
but I
Yeah.
respect the fact that I live in a democracy and they have the right to
Yeah.
have that opinion, and I have the right to vehemently oppose that opinion if I think
That's
it's
right.
wrong. Yeah.
That's right. Absolutely. Well, thank you, Daniel. And, thank you for joining us today and sharing your incredible journey across healthcare, government, and now municipal leadership. Your dedication to building strong communities and supporting people across all stages of life is truly inspiring. We'll be following your work as mayor of New Westminster closely and as you run next year for the position. And we can't wait to see the positive impact you'll continue to have in both your city and across Canada. So thank you, Daniel.
And thank you, Heather, for doing this. And thank you for inviting me on the podcast. And congrats on the podcast. And it's amazing and great conversations. And I trust it'll continue into the months and years to come.
Thank you so much, Daniel. Appreciate it. So thank you for joining us today. And if you would like to learn more about how Maxwell Management Group is supporting the continuing care sector, please feel free to visit our website at maxwellmanagementgroup.com. And also, please like and subscribe to our podcast wherever you download podcasts. Thank you for joining and see you next time.